This presentation refers to the drug testing program at Canisius College, and specifically the drug screening and rehabilitation policy. This policy was amended in June of 2015. The program has two parts, both NCAA testing and Canisius' institutional testing. It's important to note that the list of NCAA banned substances is recognized by both these programs. NCAA testing is year-round, minimally once a year in the Division I schools in NCAA. It is also at championship events. It may occur over summers. A first positive penalty would result in a 12-month loss of eligibility unless it is specific to a marijuana penalty, which would be 6 months. Canisius' testing is similar. It utilizes random urinalysis and can be done throughout the year. The policy reads a first positive, will be a 10% penalty of your scheduled events. So if there was 40 games in a season, you would have a 4-game suspension. A second positive will be 50% of scheduled games, and a third will be loss of grant and aid and removal from the team. It is very important to understand that your sport's specific team rules may have a stricter penalty. Some choose to have one positive being the loss of grant and aid and removal from the team. Canisius has also introduced Safe Harbor into its program. Safe Harbor is a student athlete who would like to refer him herself or herself for voluntary evaluation, testing, and treatment for drug programs. This may only be done once and may not be asked for once there's been an impending drug test announced or documentation of a positive drug test has occurred. A student athlete will be permitted to remain in the Safe Harbor program and remain eligible for a reasonable period of time, typically not to exceed 30 days. The student athlete must successfully complete the treatment plan and is eligible for random drug testing through the college. Student in the Safe Harbor program may also be selected for drug testing by the NCAA. A student athlete seeking admission into the Safe Harbor treatment program must apply to the Senior Women's Administrator and utilize the Safe Harbor Policy Procedures Acknowledgement Form for consideration of acceptance into the program. The college's policy is annually reviewed on ARMS and is presented in person at the pre-participation meeting for each individual team by the sports medicine staff. NCAA drug classes have a lengthy list. The 5 classes are stimulants, anabolic agents, diuretics, street drugs, and peptide hormones. Some substances are banned for specific sports. This list of banned substances is given to each athlete at the beginning of the year and is also available on NCAA's health and safety website as well as gogriffs.com. There are medical exceptions for certain medications. The most common is ADHD medication, which will cause a positive amphetamine test. There are also certain instances with therapeutic testosterone. The college must have, in writing from your physician, appropriate paperwork on file for this medical exception to be warranted should a positive test occur. This form is available on GoGriffs. CNA sports medicine staff if you feel you need to fill out this information. One of the dangers in the use of supplements is the dilemma that often these supplements are seen too good to be true. It is important to remember that you and only you are responsible for any substance you apply to your body, you inject, or eat. A positive test due to lack of knowledge of the ingredients of a substance is still a positive test. Often mixed messages to student athletes in this multi-billion-dollar industry seem to attract students to try these supplements when they are not sure what the ingredients are. It's important to understand a label may or may not list all ingredients, and what is on a label may or may not be in a product, and what is not on a label may or may not be in a product. Supplements do not need to be proven effective, they do not need to be proven safe, and there is lack of standards for both potency and purity. Any supplement you're looking at, this is what not to try. If it says androlic, if an ingredient ends in ball, dol, or ione, if it is a testosterone booster, if it uses the term hypertrophic, prohormone, prosteroid, or is a designer supplement. It warns about drug testing. It's considered a water pill or a diuretic. It contains DHEA, which is often sold next to vitamins. It uses the term cycle or stack, and quite honestly, it just seems too good to be true. If you are not sure, you can do one of two things. See Andy Smith, the head athletic trainer. You should do is bring in the name of the product, the manufacturer, and if you have a website, or use the Resource Exchange Center. Either way, you will get guidance on the ingredients and dangers in use, possible positives with drug tests. The rec from Drug Free Sport is available at drugfreesport.com/rec. And as you see on the toolbar here, where it says Rec Tools, you can ask about a dietary supplement, use username NCA1 and password NCA1, and you get do an anonymous inquiry in regard to the ingredients of a specific product. It is ideal to bring in the product ingredients, the name, and the website if possible. On-campus inquiries simply bring the product or the website to Andy Smith, head athletic trainer, in the office of the Center for Athletic Training. You may email it to him as well. He will get you information from the rec and forward it along. The rec is also available on gogriffs.com, and handout cards with password and username are also available. Why risk it? Again, if you have questions on supplements or any part of this program, please see Andy Smith, head athletic trainer. Good luck this season, and go Griffs.